Yeah, because essentially the impact of this recommendation, and is this with the ACIP committee?
Yes, ACIP.
Advisory Committee for the
Immunization
practices, and that's a subset of the
Centers for Disease Control.
So if they come up with a recommendation, and in this case most likely to implement this vaccine schedule for meningitis, and the age groups you mentioned, and the schedule you mentioned, then that recommendation will be converted relatively quickly by most states, because it's a statewide implementation.
States are the ones that mandate vaccines.
And then, unless you have an exemption, which would be either be a conscientious objection, a religious exemption, or a medical exemption, then you're going to be required to receive those sets of immunizations, which if you don't have access to the public health program, it's going to cost over $500–600 in addition to the other vaccines that's already being recommended, to have your child participate in the public education system.
That's what the gatekeeper there is entry to daycare and to schools. And I'd like to say a little bit about meningococcal disease, because I think it is a serious disease. It can result in limb loss. It can result in convulsions and brain damage. And so, you know, the signs and symptoms of meningitis, of inflammation of the brain, whether it's from a vaccine or from the disease, things like a severe headache. If your child can't, or you can't put your chin to your chest without huge amount of pain, and you have a headache and a high fever.
Or the head is rigid.
The head is rigid.
Yeah,
the neck
will not move. It's just like a board. It becomes very stiff.
Exactly. If you have vomiting and diarrhea, if you have convulsions, if you have confusion with the young babies, the screaming, high-pitched screaming and the arching of the back is often a sign of brain inflammation. You need to obviously get to a doctor, because meningitis, meningococcal disease, can move very quickly. And so you need to, when you see those kinds of symptoms, you need to get it checked out.
And it can be effectively treated if you pay attention to these symptoms that you've just mentioned, and you get appropriate health or evaluation and assistance at the emergency room, because this is an emergency.
Yes.
And they're given intravenous antibiotics. You can have a dramatic impact and really resolve it completely.
Yes. But so often it moves so fast. If you're not watching, if you're not paying attention, and you don't get to the hospital. And so of course, this has been the argument. It's such a severe disease. It can result in such, you know, death and brain injury. But we have to look at the incidence. Right now, 20% of us carry Neisseria meningococcal organisms in the back of our throat at any one given time. Okay, and we're asymptomatic. What is it about people who go on to have invasive meningococcal disease? That's what they really need to be looking at. What are the risk factors? The other thing is that most of us, by the time we're teenagers, already have natural antibodies to Neisseria meningococcal. Nature has a way of, you know, we come in contact, we're asymptomatic, but we get antibodies. What's going to happen when we no longer are having the natural antibodies, when we are children are getting vaccinated at 2 months, 4 months, 6 months, 12 months, and you have vaccine-induced antibodies, which are not the same.
They're not permanent.
They're not the same as the natural. We potentially have.
That's an important point, because most people don't realize it. They believe that by getting an immunization, as recommended by the public health authorities, you're going to induce the same type of immunity that you would from natural exposure to this. And nothing could be further from the truth. Well documented. I think any respectable scientific researcher in this area would not dispute that.
Right. It's not the same as.
There are different types of immunity.
Exactly.
They're similar, but they're clearly different. And the permanent one that is typically received from having a natural exposure is far superior.
Right. Qualitatively superior. And I think that this is not something that's being looked at either. Are we going to become vaccine dependent? Are you going to see a mutation of this Neisseria meningococcal organism into a more virulent and a more prevalent form, because we have decided that we can't have 1,400 to 3,000 cases and really a handful of deaths? Not that the deaths are not important. Every life is important. But I think you have to put it into perspective. And again, adding one more dose, that'll be 9 doses of vaccines at 2, 4, and 6 months and 12 months. Where is the science that shows the effectiveness and the safety and the necessity of that?
Yeah, and I'd just like to emphasize one point also, at least about my belief with respect to these diseases, that, and especially in, why, one might ask, why is this disease so prevalent in college freshmen? Well, if you've had a college freshman or if you've had experience with them and they're going away from home into a typical college dorm, at least when I was practicing, it's not a mystery. And in fact, they even have a name given to college freshmen that they, and I forget specifically what it is, essentially refers to the fact that most of them gain 10 pounds. Mm-hmm. And it's not because their activity level did change at all, it's because their food intake changes quite dramatically and that they're really given very low quality, poor quality food choices. High in carbohydrates and sugars and sodas and foods which do not promote health. And so as a result of that, their immune system becomes relatively suppressed. They're living in close quarters, of course, with a lot of other people, and their sleep schedules get disrupted, and their immune system goes down, and that's when they're more likely to come down with this type of infection. So ultimately, it boils down to our immune system, and if we can maintain a healthy gut flora, because the flora in our gut outnumber us 10 to 1. There's literally 100 trillion bacteria in our intestinal system, and there's 10 trillion cells that we have. So if we can, by primarily our food choices, by staying away from sugars and toxins that destroy them, and providing good nutrients to build it up, especially fermented foods and probiotics, and staying away from antibiotics and birth controls and pills and things like that, then we can maintain this healthy gut flora, which is a phenomenally major component of our immune response to the environment. So that when we do have these insults, close contact exposures to people who are infected with a strain that we may not have, then our immune system come in, do the job it was designed to do, create protective antibodies, essentially immunize yourself permanently without an expensive and potentially disastrous consequence from a vaccine. Then you've got the best of both worlds. So it's not that we're saying don't do this because the cost benefit.
It's part of it.
It's part of it. I mean, and that's a decision you have to make yourself. You can look at it, make the analysis yourself, and look at the studies, and you can evaluate it. But ultimately, there's an alternative. There's a solution that you can incorporate for your family that essentially will provide even superior methods of protection.
And I think a lot of people don't realize meningococcal, Neisseria meningococcal, is not communicated by standing in an elevator with someone. You have to have exchange of saliva. You have to have, close contact. So it's not the same as
intimate
coughing.
Intimate contact.
Yeah,
so somewhat similar
kissing,
to HIV or hepatitis B.
Yeah, it's not bloodborne. It's saliva.
Okay.
So I mean, kissing, sharing toothbrushes, sharing cups, and that kind of thing. So. I mean, people just don't have the basic information that they need to have to make these informed choices. And I hope that people will take a serious look at this and give the CDC feedback, either at these city meetings or by writing to the CDC. And again, availability of the vaccine is one thing, but recommending it for everyone that then turns it into a state mandate is something else.
No, I couldn't agree more. So if you feel as strongly as we do about this, and I hope you do, then I strongly encourage and recommend you to take an active role in this. And there are two ways you can do this. There's a link on this page that you can contact the CDC and let them know what you feel, and you can also join the vaccine portal, which is an even more active role and will allow you to engage at an even higher level, to take a strong advocacy position within your local community to educate others about this important development.
That's right.
So thank you for listening, and we hope you participate to help you, your family, and your community better take control of your health.